Welcome back, everybody. Our second speaker today is Dr. Terri Daniel. Dr. Terri Daniel is a non-religious hospice chaplain, end-of-life educator, and grief counselor. Please check out her latest book, Grief at God, When Religion Does More Harm Than Healing, in our exhibit hall. It has been my pleasure getting to know Dr. Daniel over the past year, and I'm pleased that today she'll be talking to us about bereavement and bad theology, a toxic cocktail. To learn more about Dr. Daniel and her work, visit our exhibit hall. Welcome, Dr. Terri Daniel.
Thank you, Janice, and thank you, everybody. And Janice, bravo to you, girlfriend. You're doing such an amazing job with this conference, and I'm so happy to be here. I do a lot of conferences like this, and I have to tell you, this is the one I have been most looking forward to. So I'm just thrilled to be here. And unlike most of you, if not all of you, I was not raised in any sort of extreme religion or any religion. My family was Jewish, and they didn't take it seriously at all. It was a big joke to them. They had no real theology or moral codes. It was just sort of a social thing. They liked it for the family gatherings and the holidays. And they were so incredibly secular. I once asked my father when I was 13, where did Jews go when they die? And he said, to the Cadillac dealership. He was quite a comedian. And that was my whole religious education. And I never even heard of Jesus until I was 7 years old. And I remember the day. My sister and I were sitting, it must have been Easter Sunday, because we were watching TV and there was one of those Jesus movies on. This would have been in 1960. And it was probably The Robe, one of those movies. And there's the crucifixion scene, and I see them nailing nails into this guy's hand. And I'm 7 years old, and I start freaking out. I run into my mother's bedroom, and I'm crying. And I say, I saw this horrible movie where they did this terrible thing to this guy. And my mother said, oh, we're Jewish. We don't care about that. That was my introduction to Jesus. And the other bit of religious introduction I got, I'm going to share a picture with you. In my grandmother's house, there was a painting of Moses. And I remember being a little kid and going into her house and being terrified of that painting. I thought it was a picture of God. And I have a picture of it here. I'll show you very briefly. Can you see that? That's the picture of my grandmother. I don't know if it was the exact one, but that's actually Charlton Heston in the movie The Ten Commandments. And I guess around those years, it was such a popular movie that people could buy, posters. So that was what I thought God was. And never got any of this religion when I was a kid, which means that I grew up with a kind of an open mind. And when I was about 16, I got really interested in religion because I wanted to find out what all the fuss was about. And I actually read the Bible to the best of my ability at 16, purely because I wanted to. We didn't even have one in my house. I went and bought one. I don't know where I got it from. And I've got really fascinated with it and with spirituality and everything, and went through this whole long journey of experimenting with everything. So why am I here? Why am I speaking at this conference when I am not traumatized by religion? How did I get here? So here's a little background on that. Long story, short version, I got very interested in death and end-of-life care in my early 50s. My son died in 2006 when he was 16 after a long debilitating illness. And I was fascinated by the whole process of life and death and grief. Obviously, I went through all that like a normal mother, but I also had this kind of intellectual curiosity about it. So I became a hospice volunteer. And in the early years as a hospice volunteer, I would talk to the patients and the families, and I would hear them agonize over their spiritual questions. They were mostly Christians, and they were struggling with, am I going to go to hell? What happens in the afterlife? And there would be conflicts in families because of different belief systems. And I was watching all this. And as a volunteer, you're not really allowed to talk to patients about that. You have to be trained as a hospice chaplain to have those kinds of conversations. And I really wanted to have those conversations. So I decided to go back to school and get trained and educated as a hospice chaplain. At age 56, I went to college for the first time. I never went when I was young. I got a degree in religious studies. I did chaplaincy training and internship. Then I got a master's in pastoral care and realized I didn't really want to be a chaplain. I wanted to be a teacher, so I had to get a doctorate. And fast forward, 10 years have gone by of me in academia, getting all this alphabet soup after my name. And what it turns out to be is that I help people recover from religious trauma in relation to grief and loss in particular, and in death even more particular. But loss is loss. Death is not the only kind of loss that we experience. You know, we lose our jobs, we lose relationships, we lose our health, we lose our animals, we lose our identities. So, you know, all of you that are deconstructing right now are going through the process of loss and grief. Even though you're not sad to lose the religion you walked away from, there is a grieving process there, because there's a part of you that's been with you your whole life that you're killing off, and it requires certain practices to let that part go with love and compassion so that you can build the new self in a new way. So my background was just so weird and diverse. For many years, I was a pretty hardcore atheist. I was on the board of the American Humanist Association for 10 years. And as things started to happen and I started to study all this stuff, I started to see that there is an aspect of sacredness, of an internal mystical world, an afterlife even, that we can understand with no religious context. And I started to really experience this with the hospice patients, which now I'm able to talk to about these things. And I see them in their suffering about going to hell. And what I want to say to them is just strip all that shit off of there. Just get the religion out of the conversation. Fuck religion. Let's just be with what you're feeling in your heart or your soul, if you dare say, you know. And so separating those things out is something that's really important in my work in counseling people who are going through this, because a lot of them do have a spiritual component. They've had near-death experiences. They've had visions at the bedside. They've had mystical experiences, not like the ones in a group when people are speaking in tongues, but personal experiences where they've experienced another level of consciousness beyond just the physical. So that's all incorporated in there too. And before I talk about that, I want to go back and explain a little bit about what chaplaincy is. A chaplain is not a pastor or a priest or anybody involved in congregational work with a church. If you ever are in a hospital or a hospice and a chaplain comes to you and it turns out that they're just the local pastor from the local church, that's not the guy you want to talk to. Chaplaincy is a whole process of training. It's 1,600 hours of internship. It's a lot of schooling, a lot of study. And ultimately, where you come to at the end is you leave religion at the door. That is the purest form of chaplaincy. So the chaplain who comes to see you in the hospital, I don't care if he's a Buddhist, Christian, Jewish, atheist, doesn't matter. When he walks into that room, he's blank, he or she. And it's not easy to be there because I'm certainly not blank. When I walk into the room and I see the patients worrying about hell, or a family member trying to convert a dying family member at the last minute, or all of that, I get very triggered from my own thing. I want to yell at them sometimes and tell them there is no hell. None of this is real. You don't have to suffer over this. But in my professional capacity, I have to be very careful about how I present it to them. So there are ways that we are taught to do this, and I'll give you an example. We do in courses that I teach. Oh, by the way, I also am a professor at a seminary. So I have got like one foot in each world, but it's a very progressive seminary, the Graduate Theological Union in Berkeley. And my classes are all very religiously neutral. I teach about death and dying and grief. And my students are sometimes very religious people. I've got Catholic priests, I've got Buddhist monks, I've got rabbis. It's fascinating. But they all come there with a very progressive outlook and a very open mind. So one of the things I do in one of my classes is I do a role play process to train these chaplains in how they're going to be in a situation. And one of the role play things I give them is you're in a hospice facility. The mother is in her 80s and she's dying, and she's an atheist, been an atheist her whole life. The daughter is a born-again Christian, and she's in the room sitting at the bedside with her mother, begging mom to find Jesus and be saved before she dies, because otherwise she's not going to go to heaven and they won't see each other in the afterlife. So in my classes, I take a student and I say, now you're the chaplain, you walk into the room and you're watching this conversation. How do you respond? What do you do? It's a great question. And I'm just going to jump right to the answer. And the answer is, and this is something that may be helpful to you in the conflicts you have with your friends and family members who are still in the religion, is to turn the religion back on the person. So what I would do with that daughter is I would say, first of all, I would get her out of the room because mom is very busy trying to die. It's a labor-intensive process. You don't want to throw a bunch of stress on somebody who's dying. So get the daughter out of the room. And I would say, what does your faith tell you about this? Do you believe in prayer? Oh, yes, I believe in prayer. Jesus is watching over us and God listens to me and prayer works. And I would say, then there's a little chapel down the hall here in the hospital. Go in there. Talk to Jesus about it. Work it out between you and your God, whatever that is, and keep it away from the patient. Keep it away from your mother. And then they're sitting there going, but I have to convert her. She's going to go to hell. And I will come back and say, that's between you and your God. What do you believe? Do you believe in forgiveness? Oh, yes. Jesus forgives everybody. Well, then maybe your mom will be forgiven. Whatever it is, it's between you and your belief system. And they don't quite know what to do with that. Then they're sitting there holding the bag. They have to own this belief system. And they're immediately faced with all the contradictions. Do you really think God is going to send your wonderful, beautiful mother to burn in hell forever if you don't get her to say certain words on her deathbed that will make you feel better? So it's an interesting process that we do, is turning the faith back on the other person. I want to talk about, I'm going to give you some case history. So that's one. I've actually had that patient. So here's some of the things that I've run into with facing death and loss. So a pediatrician friend of mine told me this story. He had a family with a 2-year-old who had brain cancer. And the child was clearly dying. They had done everything they could. He was really ready to die, ready to go into hospice care. The family was Pentecostal. And so they had all the prayer groups going and the church prayer chains and everybody praying constantly worldwide, praying for a miracle for this child to be healed. And the doctor said, at this point, we really need to talk about your end of life plan. It would be good if we took him out of intensive care now and put him in hospice care. Let's talk about, do you have a mortuary in mind? This is what you have to do when you're that close to death. And the family said, we cannot even talk about that. Because if we even utter those words or have that conversation, God will know that we're not faithful enough. And we don't believe in his ability to intervene and heal. So, of course, the kid died. And the family then went into what we call complicated grief. So what happens to that family and all their friends is, And you guys know this better than I do. What did we do wrong? We didn't pray hard enough. Our faith wasn't strong enough. There's some little sin that we have somewhere that God knows about that we don't know about. It's a punishment. We failed. And that comes from, the innate message of the Judeo-Christian world, which is no matter what you do, you're going to fail because you're unworthy and sinful, and you will never be good enough. And self-loathing is the theme of everything. And so how can you possibly cope with a loss like that in that religious framework? Here's another example. A woman, her 10-year-old son died from leukemia. And she believed that this happened because 20 years earlier, she'd had an abortion and God was taking the life of the one child in exchange for the other one. And again, she came to me with complicated grief, and I'll explain what complicated grief is in a minute. I'm going to give you two more stories. One woman told me that all 4 of her children had died over a 25-year period in separate, unrelated events. One died as a baby, another one got hit by a car at 10 years old, another one motorcycle crash, another one died in the war. And she said, I thought if I was a good Christian and if I pleased God, that things like this wouldn't happen to me, but they kept happening. And now all my children are gone. And all I can think about is, what did I do to make God mad? What did I do wrong? If I knew what it was, I could correct it. But how can I ever know what it is? And she asks me, why would God do this to me? Well, I can't give her an answer that will make sense to her. So my answer to anyone who asks me a question like that is, you have to deconvert, you have to deconstruct, you have to give up that image of God. So when they say to me, why did God let this happen? I say, it depends what you think God is. And if you're willing to do a complete theological overhaul, then you might come out of this with some peace. But as long as you're holding on to that image of God as a man in the sky with human characteristics that watches and judges us and makes everything happen with his magic clipboard, you're never going to be able to truly find peace with your grief. Now, these are the people who come to me with complicated grief, and I'll explain what that is in a minute. The final case history I want to give you is a woman whose husband was killed in a car accident with a drunk driver. And she was understandably really angry. A lot of anger when something like that happens. But she believed that anger is not an appropriate form of Christian grief. And I'm sure many of you have heard about this before. There's a lot of material out there about biblical grief or proper Christian grief. You're not supposed to be angry because anger is a sin just by itself. And you're not supposed to grieve because your loved one, no matter how they died, they're in heaven now. So you're supposed to be happy. So every time you're feeling that pain of grief, you're getting this pain of guilt. I'm not supposed to be feeling this. So the theology just completely pollutes the grief process. And that's kind of the story of who I am and what I do. I want to show you something now that, I'm glad I didn't get to do my presentation until today on Saturday, because I got to watch what all the other people were presenting, and nobody showed this. And I'm really happy that I'm the one who gets to do this. Some of you listening, if you've studied psychology, you may be familiar with Fowler's stages of faith development. So it's based on psychology. You may have heard of like Erikson's stages of cognitive development, where, when a child is 2 years old, they begin to think a certain way. And then when they're 6, their logic progresses to this and that. And then they have verbal skills and so on through the lifespan. So this has been around in psychology for a really long time. Well, around 1980, a guy named James Fowler came along. And he took those well-known stages of cognitive development in psychology, and he applied them to religious thinking. And I'm going to show you a quick little PowerPoint here. And I'm going to walk you through all these stages because you're going to see what happens as you evolve through really infantile kind of faith, like the kind most of you were raised with, to a more mature kind of faith, to a complete freedom to choose however you want to see the universe in the way that makes sense to you. So here's this. Can you all see this picture of a baby? Okay. Okay, so his first stage he calls primal faith, and that's when you're an infant. And faith to you is basically that you have parents who are going to feed you and take care of you, or maybe you have parents that are going to abuse you. Either way, this is your foundation of how you develop a sense of safety in the world. And those experiences actually form a preliminary image of what can become the idea of God when you're raised and given a religious education. At this stage, your parents are God. God means, food goes in your mouth and you're warm and dry and fed. So as you grow up and your parents start indoctrinating you into God, this primal level of understanding sort of comes into play. The next stage comes at about 2 to 6 years. Now, these ages are completely approximate, so don't hold me to that. Don't hold Fowler to that. But in this stage of development, a child is able to use speech and symbols to organize thoughts and experiences. And important to note that this is the age where you start getting your religious indoctrination, 2, 3, 4, or 5 years old. You start going to Sunday school and hearing all the Bible stories and all of this. And so an example of this stage 1 faith is this 6-year-old who described heaven as a place high in the sky where God lives with the 3 wise men, baby Jesus, and some of the saints. So you pour all this stuff into a child's mind, and this is what they come up with. Because children assume that what they are taught is the only possible perspective at this age. So the next stage is called mythic literal faith, about 6 to 10 years, again, totally approximate. And at that age, child is able to make meaning of stuff. So if you tell an 8-year-old that elephants can fly from like the movie Dumbo, they know that that's not true. They're able to start discerning literal from figurative, but not all the time, depending on their age. And so an example, and depending on their indoctrination, even more. So an example is the story of the dead seagull. A 4-year-old and his father are walking down the beach and there's a dead seagull. And the kid says, "Daddy, what happened to the bird?" Daddy says, "Well, it died and went to heaven." Kid looks up at heaven, looks down at the dead bird and says, "Did God throw it back down?" That's that kind of mythic literal faith. And many people, even adults, still are in this stage. And that's biblical literalism right there. The next stage, adolescents and some adults are still locked in at this stage. Okay. Stage 3 is we're right about adolescence. And this is where we start questioning ingrained ideas and start creating a personal identity and building relationships outside the family. At this age, what's the most important thing in the world? Your social life, your friends, having friendships outside of your parents. Many of you didn't have that. Your only friendships were inside the church. This is also the most common age for church youth groups. And I imagine this photograph right here is probably very triggering for some of you. It creeps me out to see it. And I was not ever one of those kids. And so this synthetic conventional faith is about belonging. I want to belong to my group. I want to be popular at school. I want to have friends. I want to have a social life. So you kind of just do what is prescribed and what everybody else around you is doing. So biblical literists, evangelicals, cult members, and other strict religious adherents are usually locked in between stage 2 and stage 3. Now, I have this whole thing printed out of Fowler's stages for you. So if you go into my exhibit booth, you can download a document that explains this in more detail. So most of the people that you guys have dealt with all your lives and that I run into in hospice are somewhere between that 4-year-old to 12-year-old state of mind about their theology. And they get that way because if you're given your theology at 3 years old, which most people are, 3, 4, 5, you just kind of go through your life and you never think about it again. You never question it, because why would you? If you're raised in a cult, then you aren't even given a chance to think about it. You're not even allowed to. You're just squeezed down into that little box and you never get to question it until something traumatic happens. And that's when the questioning happens. We'll get to that in a minute. So something traumatic happens, really traumatic, like at whatever age. Let's say you're 50 and you get a very serious illness, 50 years old, you have 3rd stage lung cancer, or your child dies, or your village is bombed in a war, or any of the traumas that people go through. All of a sudden there, you're going to say, well, why wasn't God there to help me? I always believed that, God would just reach his hand in and pull me out of this mess or heal my cancer. And it doesn't happen. And that's when you begin to question. And this stage 4 is when you really reflect on it. You question established beliefs, especially in response to loss. And what happens there is you begin to seek understanding instead of belonging. Huge step in the increase of awareness and consciousness. And then moving on, hopefully many of us will get here. Again, the ages don't really matter. I feel like I got here when I was 13, but it's different for everybody. The spiritual crisis has now prompted such deep questioning that you look more deeply at everything that was previously taken for granted, and you start talking to people about it like we're doing here. And that was the example I decided to give on this slide, the Conference on Religious Trauma. This is a stage 5 event that's giving us the opportunity to move together into this next stage. And the final stage, universalizing faith, I can't see it because my little screen thing is here, hold on, is when you finally get to the point where you can see everything in a transcendent way, where you're more concerned with personal revelation, which Fowler means is, the growth inside yourself, your ability to understand, to be resilient, to make sense of things that happens in a way that is rational and graspable for you. You're more concerned with that, getting to that place in yourself, than with symbols or doctrines. And at that point, you no longer need any of that stuff, and you're able to walk away from it. Okay, let me figure out how to stop sharing here. Oh, and here's the example. Emerging from grief with a positive outcome that includes a peaceful acceptance of the natural ebb and flow of sorrow and joy without the influence of toxic religious teachings. So I know that's a lot to take in. Let me talk about complicated grief. So grief is the most normal, natural thing that could ever happen when somebody dies, when you lose something. Grief is the response you feel, that punch in the stomach, that pain, that crying, that missing of something that's not there anymore. It's a normal, natural response to loss. Almost all the time, it does not require therapy. It does not even require counseling. If you have proper social support and a healthy grief environment, you can go through it without counseling intervention. Basically, what grief counseling does is give you a space to talk about your experience, to process the trauma, to talk about it. But generally in grief counseling, they don't give you any hands-on practical tools. And there are all kinds of hands-on practical tools that you find, that I do in my work, that you don't find in traditional counseling. We don't have time to talk about that today. But There is something called a normative, healthy trajectory of grief healing. It has nothing to do with the 5 stages, and Elizabeth Kubler-Ross just throw that out. Nobody uses that in grief work anymore, and that's a long story for another conference, another conversation. But we don't do the 5 stages. There are no stages. What we have now is tasks of grieving, the things that you do as you go along. So, for example, one task of grieving is to recognize the loss. So if you have someone who died in a war missing in action and you never saw a body, or if you have someone who was kidnapped and you don't know where, you never found out what happened to them, you are not able to fully recognize the loss. That's one example of one of the tasks. Another task is readapting your life to fit without that thing there. And I say thing because it's not only just a person that you lose. It can be a job, a lifestyle, an identity, a house, anything. Is rebuilding the new life and adjusting to the new world without that thing. That requires resilience. And not everybody's good at resilience. Resilience has certain characteristics, like the ability to think independently, to see a problem and address it and take action to solve it. The ability to communicate honestly with your group, with your community, your network, your tribe. If you're raised in a religious cult, you don't develop those skills growing up as a child. And so if you have now come out of a cult at 40 years old and you're trying to deal with grief and loss, you're going to be lacking a lot of those innate abilities because you were not encouraged to develop them. And it really all starts with, critical thinking. Anyway, so the normal trajectory of grief is that you go through these steps, not in any particular order, and eventually you come to an acceptance of the new normal. I'm in my new world. I no longer have that thing anymore. I have the support of my friends and my community. I can rebuild and I can build something new. But sometimes it doesn't go that way. Sometimes it's interrupted by something that we call a complication. And the word complicated is not like we use it in popular lingo right now, like, oh, I'm in a relationship, but it's complicated. It's not that kind of complicated. It's like if you have a normal surgery, like you get your tonsils out and everything went fine, but then you got an infection, then the surgery had a complication. You've heard doctors say that. Well, everything went well, but there were complications. So it's that. It's something that comes in like an infection that complicates the normal process. And there are long lists of risk factors for these kinds of complications with grief. To name a few, if it was a violent death, if your loved one was shot on the street, then you're going through these tasks is going to be a little more difficult. If it was a socially unacceptable death, like a suicide, or maybe your loved one was the guy who went and shot kids in a schoolyard and then was killed by police, that's a socially unacceptable death. You're not going to have network support, your friends, nobody's going to support you if you're that guy's mother. Your past losses, if you've had just one death after another, and you're just crushed and you just can't carry the weight of another one, that can lead to complicated grief. There's tons and tons of stuff. I did my doctoral research on complicated grief with a very specific angle, and that was toxic theology as a risk factor for complicated grief. And in all the research that I looked at on this, all the top experts, the grief theorists and the researchers and all the big wigs in the academic world, not one ever said anything about toxic theology and complicated grief. And I was so excited. I'm like, yay, I'm going to be the person who does this. But it is a huge risk factor. So if your loved one dies by suicide and you believe that all suicides are going to go to hell, you're going to have complicated grief. You're not going to cruise through those tasks and processes of mourning because you're going to get tripped up on that thing. And the way complicated grief manifests itself, the way you recognize it in someone is, say, 6 months to a year to whenever after the loss, the person is not fully functional. They're crying every day. They're eating too much or too little, drinking too much, getting physically ill, getting addicted, having really difficult relationships, not connecting with life, not able to work, not ever finding peace or joy. And the DSM, the handbook of diagnoses in psychology, says that you can diagnose someone with complicated grief 6 months after a loss. I think for a normal loss, like your 85-year-old mother or father dies, I'd say 6 months is probably good. But if your 13-year-old kid gets killed by the police, 6 months is way too soon. You're going to be messed up for a lot longer than that. And again, it has to do with the type of loss and the type of death. So the people who I work with come to me when they are struggling with complicated grief. And they are saying things, like my friend whose 10-year-old son died of leukemia, and she believes that God's punishing her because she had an abortion 20 years later. And she's not moving, even though this kid died a long time ago, she's not moving in a healthy way through those processes. And what you find when you scratch the surface of most people with complicated grief is that there's a religious element in there someplace. And I try to unpack that and get to that and find out what it is with the person. I guess we need to stop for questions now. I'm sure there's a lot. I could go on and on forever, but I'll stop.
Wow, that was so interesting, Dr. Daniel. Thank you for sharing that with us. And it goes so perfectly with the talk that I did on grieving our losses when we leave religion. You can see how those things just intersect. I had a question from someone. They were wondering, how can we support, so we as a non-believing person, non-religious person, how can we best support a friend who is a believer, who has had, who's had a loss, and they're struggling with this whole idea of if they think their loved one wasn't saved and their loved one went to hell. Is there anything that you can tell us that we can try and do to help?
Yeah, it's a good question. It depends where that person is. If that person's in a place where they're open to questioning their theology a little bit, if there's a little bit of wiggle room there are a lot of tools and resources you can give to that person. And, we're talking about books and articles. My new book, Grief and God, When Religion Does More Harm Than Healing, would be a really good book for somebody like that. But they have to be ready. And they may not be. And as a friend, sometimes the only thing you can do is do nothing. Just sit there and support them. That's the hardest thing in the world. Mm-hmm. And say, can I clean your bathroom? Do you need something at the store I can get for you? I mean, sometimes it's just that simple with grief, because you're not going to be able to move that person from where they are, especially if it's acute, if the loss has just happened. Now, if it's like a year later, they're going to have had some growth, and it depends on what influences are on them. If they've been like deeply mired in the church for that whole year, mm-hmm. It's going to be hard to move them. The hardest thing is to let go, right? I mean, just like we don't want them preaching at us, we also should not be preaching at them.
Yes. Oh, yeah. Great answer. Okay. Some people say, what's the harm in believing in heaven, even if it's not real? I'm curious to know your thoughts on or experience with this with your clients.
I personally believe in an afterlife, but it is not a religious afterlife. So I happen to believe, and this is from my own personal experience as a seeker my whole life, mm-hmm. I know that there are other levels and dimensions of consciousness beyond this third dimension physical body. That's just my thing. but it has nothing to do with religious doctrine or religious history or scripture or concepts of God or images of God. It's completely stripped of that. There is a book by David Staume, Staume, called The Atheist Afterlife. That is a really good read. That's really helpful. You know, when I talk to people who believe that there's some other dimension beyond the physical, that the consciousness that we identify with as ourselves, this thing that is Terri, that lives inside this body, exists on other planes at other times. For example, in dreams, in meditations, and I see it with dying people on their deathbed all the time. They're talking to their dead grandmother standing at the foot of the bed.
Mm-hmm.
I think that's real.
Mm-hmm.
But that grandmother's not in the heaven with the gates and the angels. So that's a consciousness existing somewhere in the non-physical universe. So I try to help people just strip the religiosity out of those ideas.
Mm-hmm. I wonder about, have you had the opportunity to sit with atheists who are, who are dying?
You know, I will tell you that the people I see who really have the most pain at death are atheists and Christians.
Why the atheists?
Well, because they're attached to their physical life. Like one man that I had, he was so sad because he never got to do what he wanted to do in life. You know, he wanted to be in a sailboat race.
Mm-hmm.
You know, he had a bunch of sons and he always wanted a daughter, you know, and to him that it's all over now.
So there were regrets there.
So many regrets because this is all there is.
Mm-hmm.
And there's no opportunity to create anything new or process anything old in another form other than a physical body. And the Christians, their problems are obvious. We've already talked about that.
Yeah, you answered that about, okay, well, let's see. How do you best sit with people and unpack the toxic religion that is likely complicating their grief if they aren't willing to change their beliefs? Then I think you already covered that in saying you can't make them change. You can't make them see anything differently. Sometimes you just have to be quiet and ask, how can I help?
Yeah. I don't know if you guys listen to the How to Heretics podcast. Those guys are good friends of mine. I was on their show a few weeks ago and we were talking about this. And Mark said, yeah, don't just do something, stand there. And that's pretty much it. But, you know, we always want to fix somebody. It's so uncomfortable for us to just be somewhere without fixing it. And I have had people with the weirdest beliefs. I had a man in the hospital once. He was in his 70s. He was just diagnosed with a life-threatening illness. He called for the chaplain. I came in there and he said, "Chaplain, where do you think Muslims go when they die?" And I said, typical chaplain answer, "I really don't have an answer for that. But what do you think?" Because you always turn it back on him, right?
Yeah.
Reflecting thing. And he goes, "Well, they go to hell with the Buddhists and the atheists."
Oh dear. Was that my father?
And so, you know, here I am talking to this guy and I said, okay, if that's what you believe, but why does that concern you? Well, I'm going to die and I'm afraid I'm going to go to hell and I'm going to be with them instead of with the good Christians like me. And, you know, and what can I do with that guy? How can I help him? And what I really want to say is, listen, everything you're saying is complete bullshit. And if we had a few hours, I would sit here and I would try to talk you out of it. But of course, you can't do that. You know, so what I did is I turned his faith back on him, like I said before. And I said, well, what does your faith tell you? Well, my faith tells me that if I accept Jesus, I'll be forgiven. And I said, well, then what are you worried about? You're good to go.
Right. Just time for one last question. Do you ever work with atheists who may have used psychedelic therapies to ease the death transition, or anyone?
Well, yes. In fact, my good friend Andrew Jasko, some of you may know who he is, it specializes in this work. And psychedelic therapy is also being used, to treat death anxiety. They're doing research on that at Johns Hopkins Hospital. It works. It's for everybody, not just for atheists.
Yeah.
Yeah.
Yeah, I'm so glad that there are studies underway about that. That's going to be fascinating to keep our eyes on. And we're out of time. Thank you for a very interesting discussion. I really enjoyed it. Thanks so
Thank
much.
you. And if you guys go to my exhibit room, you'll find some links and that Fowler thing, and also a link to a seminar that I'm doing in July about grief and God that you're all invited to. So
Terrific.
thank you.
Thanks so much.